Hi, my name is Dr. John Pujals. I'm a dermatologist in the Neenah location for Dermatology Associates of Wisconsin. I've been practicing dermatology for about 17 years, and I was able to do a fellowship in dermatopathology, which is an exciting field that looks at cells and tissues under the microscope to make a better diagnosis for patients that we see clinically. I went to school primarily on the East Coast, the University of Delaware for university. I went to Albany Medical College for medical school. I joined the Army and did a residency in San Antonio, Texas, and ultimately I did a fellowship in dermatopathology at the University of Arkansas for Medical Sciences in Little Rock, Arkansas. There are many patients that see us who come into the clinic and they're very concerned about different spots on their skin based on their growth patterns or their recent changes in color. And it's very exciting for me to be able to look at the skin and let people know that based on the appearance clinically, that it's a benign lesion. There are some lesions, of course, that are of concern, and when I do remove them by biopsy and I'm able to look at the slides later, I'm able to determine if those cells in fact were benign or harmless, or if in fact they were malignant and they need to be treated. So many of these skin cancers that we see in the clinic have an extremely high cure rate, especially if you come in early. So the earlier that we see you, the better we can treat you and the higher the cure rates are. I'm happy to be in Wisconsin because growing up, I moved around every 3 years as an Air Force brat. My father was an Air Force officer, and even though I was very flexible in moving from place to place, it's really nice to have a home base to take care of patients and to understand in general the cultural influences that I see in this area, especially the people from Germany, Belgium, Scandinavia, and Northern Europe. My wife and I really love to travel. It's really exciting to see other countries. We've been to Korea and Europe, and it's really fun to take the children to San Francisco, Orlando, Florida, and other places in the Caribbean. The great things about having stepchildren and still children of my own is that we're always busy and we're never quite sure what we're going to do from weekend to weekend. Over the 13 years here that I've been in Wisconsin, I feel a lot of the patients that I've met and treated have come to me primarily because of my willingness to listen. I'll pay very close attention to the problem that they have, and I'll come up with a treatment plan, whether it's medication or surgery, to make their problem better and manageable as they go forward. I feel if I give the patients the information they need, whether about a benign condition or a more serious condition, they'll have more peace of mind going forward on how to manage the condition and how to make sure that it doesn't worsen in the future. I'm Dr. John Pujals, and I'd love to see you in the clinic to look at any spots you may have worried about in the past to give you peace of mind.